This video is about novel drug design for Parkinson's disease. Before entering the main topic, I would like to introduce a little bit on disease. Parkinson's disease is the second most common neurodegenerative disorder that affects 2 to 3 of the population that equal or more than 75 years of age. There are a variety of symptoms for Parkinson's disease. Tremors are common, but this disorder also commonly causes stiffness or slowing of movement. Neuronal loss in the substantia nigra, which causes fetal dopamine deficiency, and intracellular inclusions containing aggregates of alpha-synuclein are neuropathological hallmarks of Parkinson's disease. A drug design starts with target identification. To obtain target of interest, literature review is the most common method. After identifying the target of interest, you can search the structure of this target in protein databank to decide the drug design is structure-based drug design or ligand-based drug design as following. If the structure of the target can be found, then we can proceed to structure-based drug design. The target that I choose is alpha-synuclein. Recent studies have proven that alpha-synuclein may be a possible therapeutic target for Parkinson's disease. Furthermore, there is no FDA-approved drug against this target. Now, we'll proceed to target validation, which is identifying binding sites of target which is alpha-synuclein. This can be done by doing literature review, searching CHEMBL, and also protein databank. After we have obtained the structure of target, next stage is lead identification. This is a process whereby hits from screening are transformed into leads that can be then used for lead optimization. There are 2 steps of lead identification, which are de novo drug design and molecular docking. De novo drug design is a method of building novel chemical compounds starting from molecular units. De novo drug design involves pharmacophore modeling. Pharmacophore modeling starts with non-protein structure. Then we'll proceed to structure-based pharmacophore model generation. Cross-crystallization complex of alpha-synuclein with inhibitor are analyzed by using ligand score 2.0 software to produce analysis of alpha-synuclein and inhibitor interactions. The examples of interactions are hydrogen bond donors, hydrogen bond acceptors, and hydrophobic region. This is an example of pharmacophore modeling result. It shows active sites of the target and also it shows active sites of the target. To confirm validity of pharmacophore model generated, we can use training set and test set. After the validation, the pharmacophore model can be used to search for proton hits compounds in 3D chemical database. Molecular docking is one of the most applied virtual screening methods, especially the 3D structure of target protein is available. This method could predict both the binding affinity between ligand and protein and structure of protein-ligand complex. Molecular docking starts with hits compound obtained from chemical database. Then, by using PyMO, analyze binding affinity between alpha-synuclein and lead compounds, and lastly, choose proton lead compounds based on the results. Lead optimization is a subsequent stage after lead discovery. In this stage, attention is paid to improve the drug-like properties of lead compounds by making small modifications to the lead. They have to be optimized in terms of potency, selectivity, pharmacokinetics, which are absorption, distribution, metabolism, and excretion, which are ADME, and toxicology, T, before they can become candidates for drug development. The drug likeness of lead compound can be screened by Lipinski bioavailability rules of 5, which are hydrogen bond donor less than or equal to 5, molecular weight less than 500 Da, log P less than or equal to 5, and hydrogen bond acceptor less than or equal to 10. The ADMET of these compounds can be modified by using KickProp software. It predicts significant pharmacokinetics and physicochemical descriptors that account for druggability of a molecule. The drug with desired properties can be obtained, such as increased surface area or by higher binding interactions, low toxicity, and so on. After lead observation, the most promising drug candidate is student. That's the end of this video. Thank you.